Thank you so much, Angelique, for joining us over this conversation. We had, of course, reached out to the Department of Health within the Limpopo province, and they refused to comment, saying this matter is in court. They will make a comment afterwards. But just from your perspective, give us context in terms of what exactly is happening with those two doctors who we're reporting, as per our understanding, they're being forced into quarantine after testing positive.
Good morning, and a good morning to all the viewers out there. Yes, Sama is very happy to announce that we brought the Department of Health from Limpopo settled last night, and these doctors were released to go home. And so there was a settlement. I don't have all the detail because our lawyers are still busy drafting a media statement on this. So you are the first people that hear it right straight from us that the matter was resolved for now, and those two doctors sent home before any testing has been done, anything. It was on behalf of our court order or our interdict that we brought. As I said, they settled.
Absolutely the right platform to share the news for the first time here on ENCA. Angelique, but give us the context, though, for those who don't know what the issue was, that these two doctors tested positive and there was, this move to place them on quarantine at a secluded site. People who are not familiar with the facts, some of them would say, but why not?
Okay, first of all, it is important to understand that the guidelines are telling us that if you are positive and you're not really ill, because there's a lot of people who's positive with very little symptoms, then you should stay at home, self-isolate at home, and for 2 weeks you will be visited by emergency healthcare workers that will come and make sure and take your temperature every day and make sure that you are under self-isolation. Now, what happened in these two doctors' case? They both work in the same hospital, but they stayed in Modimolle, if I'm not mistaken. So the one traveled to Joburg beginning of last month, and then by the end of last month, it's very difficult to say whether she got it from her visit to Johannesburg or whether she got it from the patients in Mpumalanga. It's difficult. You cannot say where she got it from. But that's not the point. The point is that these two doctors, the one got a bit of a fever or flu-like symptoms. They went, they asked, first of all, the hospital whether they can be tested there, and the hospital said that's not their policy. You have to have international travel, or you have to prove that you was in contact with someone else, and therefore they don't think that they can test. So on Sunday, a week ago, they then went to a private lab, test themselves. Both were then found to be positive, although the one doctor's got no symptoms. They then alerted the employer, who is the Mpumalanga, but as I said, they stay in Limpopo. So they then went into self-isolation. It's only the two young doctors living in one house. There's no one else at that house. They did all the right things as per the book.
Right.
And then they were told on the last week, Wednesday, that they needed to go into forced isolation.
So it is about that whole issue of whether or not to self-isolate. I'm sorry, Angelique, we are almost out of time, and I do need to push you a bit. I'm doing this because I need to bring it. Yes.
Okay, let me say, these doctors followed the rules. The Limpopo didn't follow the rules.
All right. So let me bring in as a last aspect then and broaden the discussion and talk about the safety of healthcare workers, firmly in the spotlight at the moment, with several unions raising their concerns about the availability or otherwise of personal protective equipment, PPE, and we're seeing multiple initiatives being done at various universities, to try and plug that particular gap. Also, consignments announced yesterday yesterday in partnership with the Motsepe Foundation, and also that situation at St. Augustine Hospital in KwaZulu-Natal. As SAMA, how concerned are you about the safety of healthcare workers and the issue around personal protective equipment?
SAMA is very concerned, and SAMA has released a statement to our doctors, advising our doctors that you need to have the minimum gear. The minimum gear, especially if you're working in a clinic or in a casualty environment, again, especially in the public sector where we know there's a huge problem, you need to have at least a mask, an apron or a gown, gloves, and a protective eyewear. Or goggles, as we said, and there should be social distancing. So, and we also sorted this with the Health Professionals Council from South Africa, where we said, look, if our doctors refuse, they don't feel safe. They're not refused, they don't feel safe. Would you prosecute them? And they said no.
Right.
The doctors must. You as a doctor need to feel safe that you are protecting yourself. You cannot go and examine a patient with nothing on you, knowing very well that you yourself can be infected and you can infect your family or other staff. You cannot do that. There's no ways.
All right, then. Well, thank you so much, Angelique Kutsia, for joining us right here on ENC, raising important points there, that doctors also have a responsibility because they know the protocol, they know the procedure when dealing with a patient that has, a contagious or rather an infectious virus, and therefore it's understandable why health workers in Wentworth are protesting at this time.